Hello, this is Rashi Sahai, and you're watching Medicircle. Today, on our Children's Health Awareness series, we have Dr. Dasmit Singh Khokar with us. Dr. Dasmit Singh Khokar is a pediatric surgeon in Pune and is currently practicing in Jehangir Hospital. For the past 27 years, he has worked as a pediatrician. Welcome to Medicircle, Dr. Dasmit Singh Khokar.
Thank you.
So, constipation is very common in children of all ages. Almost every from 1 of 20 visits a doctor with the problem of constipation. So, doctor, can you please tell us that what are the causes of constipation?
In children, the commonest cause of constipation is, when the child has not been fed properly, the correct type of foods that a child should be given. If that has not been done, then that would be the commonest cause of constipation. And another real common cause is where the child is not potty trained properly. That again causes constipation. There are a host of other conditions where there can be some abnormality in the development of the intestines, or there can be some kind of an intestinal obstruction which is causing constipation, and a host of other disorders which are congenital malformations. But if you ask me, the majority of the patients that we get with complaints of constipation are those where the diet has gone awry, or functionally their development has been such that the reflexes which start from the brain and end up in the intestine, they are not properly developed. So they are not potty trained properly, and because of that they develop constipation. So children with psychological problems, with developmental delay, etc., they have constipation as a pretty common cause.
Okay, doctor. So, what are the symptoms of constipation that a child faces?
See, the commonest complaint that they come with is that the child is not passing potty properly. So when we get into the history, many parents themselves are not aware of what exactly is constipation. See, the natural reflexes are the child, when we get up in the morning, we must go for passing stools. So that would be a normal reflex. So if the patient is not passing on a daily basis, or if the patient is passing stools which are very hard in nature, both these would constitute the definition of a constipated child. So if the child is having difficulty in passing stools because they are very hard, they develop some kind of a fissure or some kind of a painful lesion near the anus, and that itself perpetrates the constipation, because the child would get pain while passing stools, so the child holds the stools back. And when they hold the stools back, then the stools remaining in the intestine for a longer time, more water gets absorbed out of the stools, and then the stools become hard. Because the stools become hard, when the child attempts to pass stools, again it leads to trauma to the anus, causing a fissure, and so it becomes like a vicious cycle. So it is very important that we have to break this cycle at some point of time, and that becomes the initiation of the treatment of constipation.
So, doctor, how can a parent help their child deal with the problem of constipation?
So first thing is, we must make sure that when the child is born, generally most of the time the child passes stools within 24 hours. The first black stool they pass is called as a meconium. Within 24 hours, the stools can be passed. In a very small percentage, it might be within 48 hours. But if at all the child has not passed stools within 24 hours, our antennae should be up that something is not quite right. So there can be, some kind of a lesion, let's properly develop, or the intestines are not properly developed, so which are not allowing the stools to come down. So there can be a kind of a mechanical obstruction in the intestines. And those mechanical obstructions also, like what we call as intestinal atresias, or there's some kind of a band inside which is causing kinking of the bowel and not allowing the stools to come down. Sometimes development of the bowel is not normal, something called as Hirschsprung disease, or Hirschsprung's related disorders, or very premature babies. where the intestines are not properly developed, their functioning is not happening properly, then again the stools are unlikely to get expelled out properly. So that constitutes constipation, related to immediately after birth. Then the child, when they are on breastfeeding, most of the children would pass stools which are very liquidy, golden yellow, and many times per day. Sometimes for days together, the patient may not pass. But when the patient passes, the patient is absolutely comfortable. And when the patient passes stools, the patient is absolutely, they are like normal looking stools, soft, etc. Those are breast milk stools. The breast milk can be so well digested that there is nothing left for it to expel out as stool matter. But those are exceptional cases. Most of the time, once the patient is on breastfeeding, they pass stools multiple times a day, golden yellow, soft pellet-like stools with a little bit of water, a little bit of yellow particles. So that is normal stool. So and this child is generally breastfed till about 6 months of age. At 6 months, weaning starts. Some lesions will then present when the weaning starts. So once the child is, top feed is started, stools start becoming harder, and that's the time when some diseases will present. And at that point of time, our aim should be when we are doing weaning of the child. Weaning means introducing other feeds. So slowly, the child has to be introduced into solids, into other types of liquids. A real problem is when the child is fed things like mashed foods or ground in a mixie and then fed, or the stools are so soft that it's impossible for the child to produce some kind of a roughage and make the stools soft, and because of that the stools start becoming hard, and hard stools are really an enemy for the child because that vicious cycle starts again. Our target should be by the time the child is about 10 months to a year of age, they should be eating the same food as we as adults eat. Only difference will be the size of the bite will be much smaller, but they should be eating the same food. And as the child grows up, the child should be eating by their own hands, so they know how much of food should go inside, and to satisfy the amount of hunger that the body has produced. Any overfeeding, underfeeding, feeding the wrong kinds of foods, feeding the wrong consistency of food will ultimately lead to constipation in the long run, and then that can be quite a problem to solve.
Okay, doctor. So, can you brief us a bit about what type of food should we give to our young ones when he's suffering from constipation?
See, most of the time, we have to advise high residue diet. Like I said, most of the time the constipation is caused by a faulty diet or a faulty habit, and we need to correct that. So when we say high residue diet, we generally mean things like bread, any kind of a bakery product, biscuits, milk, top milk, not breast milk, but top milk. Definitely, they are ones which do not have any roughage in them. So whole grain foods, chapatis, bhakris, all kinds of bhajis, especially green leafy vegetables, are the most important component for producing roughage. Roughage means the food which will not get digested by the intestines, and it will produce a bulk, and that bulk is what will keep the stools soft. So roughage value in the food has to be really high. There are certain fruits like apples. They are constipators. So we have to use those foods like chicus, papayas, etc. They are they will prevent constipation also. So the correct amount of food. But to change the habit of the child sometimes is very difficult. If the child has already got chronically constipated, then we have to use something called as a bowel training program. The bowel training program can last for many months to many years to actually get the child's constipation corrected. So we start with suppositories. Suppositories are wax like medicines which are inserted directly into the anus. Now they have an advantage that they do not affect the remaining part of the intestine. They just dissolve the stools which are there locally present within the anus, the hard part of the stool, and help those stools to get evacuated. Now once that part of the stool gets evacuated, the vicious cycle gets broken, and then the child's appetite will improve. And at that point of time, we have to introduce the correct type of food. So foods with a lot of roughage value are what are correct types of foods, and those are the ones which should be used for children.
Okay, doctor. So, what kind of test should be done for constipation?
So first we start with the commonest causes of constipation. We start the treatment of a bowel training program and correction of the food. Supposing in spite of that, then we go on weaning the suppositories, go on reducing the amount of suppository. In spite of that, if the patient is not getting corrected, or the presentation is such that we are suspecting some kind of a surgical disorder, then we have to investigate those patients and find out exactly what is wrong. So we might start with a plain X-ray of the abdomen, and if it shows that some kind of an obstruction is there, fluid levels will show up in the abdomen. That gives us an indication that yes, this constipation could be related to some kind of an intestinal obstruction. Or there's something called the barium enema, which we resort to. So we instill some dye into the anus, which can be seen well on the X-ray machine. So, and we can see the movement also if we have a kind of fluoroscopy, it's called, where we can continuously scan what is happening. As the medicine is going inside, we can see the shape of the intestines. Certain diseases cause a certain shape of the intestine. From that, we can surmise what could be the cause. Now, in Hirschsprung disease, we get three kind of zones which appear in the intestines. So from that we come to know, okay, this could be Hirschsprung disease. And if a child is a kind of a spoiled child, etc., we expect them to have functional constipation, hypogenic constipation. In those cases, the barium enema will show that the intestines are hugely dilated, and they are dilated all the way up till the anus. So we know that chronically retained stools have been present in that part of the intestine. Certain other conditions which can be also made out from this barium enema. So that is one of the tests. Another test which can be something called as the anorectal manometry. So from the curves that we get on this anorectal manometry, the graph gives us some indication of some kind of a disorder which could be present. Sometimes then we have to take a biopsy of the rectum, and we go in through the anus, take out a piece of the rectum, send it for histopathology. The pathologist can then tell us, okay, there are certain ganglion cells within the bowel wall which control the peristalsis, the movement of the intestines. And if those ganglion cells are absent or abnormal, then that itself can be a cause of constipation. That needs a surgery to correct it. So we can do it laparoscopically. We identify which are the good part of the intestine and bring them down and suture them to the anus. And the abnormal part of the intestine is excess. So these are the various tests which are done, from which we come to know whether there's anything normal or abnormal happening with the intestines.
Okay, doctor. So on Medicircle, our main focus have always been to provide the audience with more information in less time. And so today we will be conducting a small question answer session in which you can either answer in yes or no, or a 1 or 2 lines answer. So doctor, my first question is that can a child have cow's milk during constipation?
Cow's milk is absolutely contraindicated because that has a very low roughage value. So it should be completely avoided.
So doctor, is constipation caused by dehydration?
See, dehydration is an acute condition, and acute constipation is a separate category altogether. Acute constipation, which is a very short duration, some child gets illness. Let's say even if the child gets some fever and the appetite goes down, and because of that the intake goes down, so the child is constipated. But then these constipations are temporary. We can give oral medications, and they will work for temporary or this short duration or acute constipation. For chronic constipations are the difficult ones to treat. The acute constipations are very easy to treat. So just some oral medication and they are okay with that.
So can constipation be triggered by a poor diet?
Yes, constipation is triggered by a poor diet, and the child has no knowledge of it. So actually, the what kind of diet to be given, that knowledge has to rest with the parents. So the parents are guided by the pediatrician, but people who do not follow that advice, especially this is seen where both the parents are working, it becomes difficult for them to implement the advice. So then they want to quickly finish off the feed and then go work. So then they make pasty kind of foods, mixer food as it is called, or they'll just quickly just fill a bottle of milk and push it into the child's mouth. So the child gets full with the milk and stops crying, and then the parents can go for work. So I mean, somehow the relationship of the constipation rests with the parents, the causative person, because the child does not know what they are fed, but the sufferer is the child, but the cause is the parents or whoever are the caregivers. So it is very important for them to be trained well, and I'm happy this your Medicircle is taking up this topic, because this should go out and reach the parents that using the correct foods and the correct way of feeding is very, very important to prevent chronic disease like constipation.
Okay, doctor. Thank you so much for coming to our show and sharing your valuable time and insights with us at Medicircle. It has been a pleasure having you on the show.
Thank you so much. Okay, all the best.